You have chronic pain in your lower back, the whole side of your body. It just seems like you've seen a whole bunch of providers and it just does not go away. You've seen physical therapists, you've seen chiropractors, you've taken medication, you've gotten injections, it's just not going away. This video is a case study of someone with those symptoms. So I'm going to read different things and comment on it because some of these things may be modalities or things you have not tried, or the mindset that you just didn't think about. So this is a story of a 49-year-old male with a 19-year history of right-sided cramps, basically sprinkled with sciatica-like symptoms. He was an active tennis player for many years with all different kinds of providers, medications, studies, no help. When I did my assessment, I noticed that there was tension throughout his body, not just on the right side. The whole body was very tense, hypertonic. There were heavy dysfunctional patterns of movements. I was looking for patterns of movements. I was looking to see, how does this individual walk? How does this individual get up? All of those were telling me the story about how this individual lives in his body. His work required him to do prolonged sitting. Basically, all of his activities were dysfunctional. His workouts were primarily upper body, and that was part of the problem. So just stick around because you'll see how. He sat about 8 hours a day, minimum. And then, of course, he drove home, which was another 30 or so, depending on traffic, of driving each way. The treatment, after I saw the extent of what had happened, and he was referred to me by someone else. So this had to be multi-level, and I explained that to him. We had to start from the very basic. You know, everyone is with this kind of a situation, it's kind of like fixing a house, only you don't have Home Depot or Lowe's or a hardware store to go buy your parts. So we had to make the parts work. So the treatment was multi-faceted, and it involved biological breathing, which is so important. This is the same kind of breathing that we understand by studying human babies. You and I and every walking human being started breathing like that, and then down the road, as a result of dysfunction, as a result of injuries, etc., we have lost that. So we need to bring that back into the picture. There were basically we had to identify all the wrongs that he was doing as we were coming across. So there were some modifications in lifestyle, there were some modifications in habits, some of the things that simply had to be changed. We changed his sitting for 6 or 8 hours to sitting to standing every 30 minutes. I know it's a pain in the butt, but that needs to happen if you don't want to have the chronic pain. I did quite a bit of active release technique type of methods on his soft tissue. This is not massage. This is to basically work on these areas that are, the muscle is tight, the muscle is dysfunctional, and it is being used. So we had to get rid of some of those trigger points, some of the tension that was created. This was a lot of work. We did nerve flossing, we did fascia work, and of course, we introduced the best exercises, in my opinion, which are developmental exercises. Developmental exercises are what you and I and every walking human being has done. When we were first born, we could barely hold our heads up. Every single one of us followed the same patterns of movement automatically. So we're hardwired to do them. I don't know why we have to reinvent the wheels. So if it worked once and it allowed your body parts to be stable from very unstable states to becoming stable, no joints, no bands, no weights, no gyms, no guidance, and we all did it. We're hardwired that way, so why don't we duplicate those? Only the difference here is you, as the patient, You, as the owner of the body with the problem, need to understand what you're doing. So that requires me as your provider to not be your provider, to be your mentor, teaching you, discussing the matters with you. So that requires active participation of the patient. So let's move on. We started doing the DNS, dynamic neuromuscular stabilization, the developmental exercises I was just referring to. We worked our way through. First was breathing. I know this was right-sided body, primarily waist down, but we have to. And the reason we have to is because as babies, we start stabilizing the trunk first. I'm not reinventing the wheels here. I'm gonna go and duplicate exactly the same patterns and progression of movement. So we started with trunk stability. He did very well with trunk stability. The issue was, as soon as we bring the legs into the picture, things would malfunction. The breakthrough happened when a lot of soft tissue fascia work was done. We did the breathing, we did some trunk stability. Of course, he changed his habits, and the breakthrough happened when we started adjusting. So I'm telling you, if I were to, from my experience, if I were to start with adjustment, this would not have happened. He'd already seen chiropractors like that. He'd already seen physical therapists. It was the combination of all these modalities, along with the adjustment, that basically started putting him on a different side of this equation. What I found interesting was, as we started working our way down to his legs and how the legs were playing with the trunk and how the trunk was stabilizing itself with different movements, what I found was how lost his feet were in the whole process. Don't think, oh, well, I've got a chronic problem, I'm gonna start with my feet. That's not the point. It's just that it was mind-boggling to me when I would have him move his ankles. He was using his thigh muscles to move his ankles. So why wouldn't this whole hip flexors, the hip stabilizers be so rigid? They were doing the function of something as far away as their ankles. And this is not because he was born this way. That's because your body is there, your body parts want to serve you. They want to do their job. But when the job is not getting done, you need to live. You need to move on. So the task gets given to a different part of your body. Next thing you know, your hip flexors, your hip rotators, your pelvis is being utilized for, in this case, his ankle movement. I never forget the session when we discovered that, and he was shocked. And bear in mind that this person, I'm so proud of him. And at one point I did tell him that I thanked him for trusting us to be part of his team, because he stuck around. And I think that's the moment he realized how dysfunctional he actually was. And he is determined to overcome this. We're doing real well there, but I just had to let you know that this happened. And the moral of the story here is that we stayed with the principles. The principles are breathing. The principles are the proper progression of movements. That means we did not go to the site of the pain or the site of the discomfort. He actually didn't have necessarily a pain that day that he came in. He would get random cramping. He would get twitching. He would get tension. It's just chronic issues that just uncomfortable in his own body, so to speak. So the moral of the story, again, is we used the understanding of human babies when it comes to movement stability and functionality as the guide. And we applied those principles across to this individual's case and we are still working together. It's been a year, but it's because of the 19 years of having this issue sprinkled with other things like sciatica is not just a recent event. And it's not going to take 19 years for it to go away. But he needed help to clean the pile here. And of course, in the process of doing it, he's understanding what right looks like. When I would say to him, do you see X, Y, and Z? Unless it was such a drastic mistake, he could not see it. And today, when he makes a subtle mistake, and I pointed out, I can see that, or he does notice it. So if you have chronic condition, if you have tried so many things and the problem is there, don't think you're a medical mystery. There is a solution. And that is the moral of this case study. If you have any questions, if you think that your case is something that you need help with, please make sure you contact me using one of the methods of contact in the description box. Make sure you subscribe, and until next time, take care.